We recently published a preprint called Social Dialogue Quality and Workers' Health as perceived by Belgian trade union representatives during the COVID-19 pandemic. In this study, we did an online survey of 469 union representatives in Belgium between August and December 2021. We asked about the way union representatives perceived the quality of company social dialogue and workers' physical and mental health. By doing so, we provide unique estimates on the relationship between social dialogue quality and perceived workers' health in Belgium during the COVID-19 pandemic. Looking at change in physical and mental health since the pandemic's outbreak, 42% of trade union representatives reported a poor mental health during the pandemic, and this was about 21% for physical health. Looking at change in social dialogue quality since the outbreak of the COVID-19 pandemic, we observed that about 55% of trade union representatives didn't experience any change in social dialogue quality. By contrast, about 30% of the sample reported a negative change in social dialogue quality. In other words, social dialogue quality was worse for 30% of trade union representatives. Now the question is to know whether there will be an association between perceived social dialogue quality and perceived change in workers' health during the COVID-19 pandemic, and we actually observe such a relationship. In other words, poor social dialogue quality is associated with poor physical and mental health, even after controlling for confounding variables, which are basically company characteristics. What is interesting is that when we control for pandemic-related measures implemented by the states to protect the workforce, this relationship still exists, but it's not significant anymore, which shows that pandemic-related measure might be somehow connected to change in social dialogue quality. In conclusion, the study suggests a positive association between the quality of social dialogue within the workplace and perceived workers' physical and mental health. But of course, this study has many limitations and much more needs to be done to better frame this relationship between social dialogue quality on the one hand and workers' health on the other.